The hairspray cap. A gynecologist recalled the worst case of his entire career. One day, a 19-year-old woman arrived at the clinic, claiming she had a hairspray bottle cap stuck inside her. At first, that didn't sound particularly unusual. Then she explained she'd inserted it when she was 15, 4 years earlier. Before the examination even began, there was already a terrible odor in the room. Once doctors took a closer look, they realized the cap had become embedded in surrounding tissue. Her body had literally started growing around it, and it got even worse. The object had eventually eroded into both her bladder and her rectum. Removing it required multiple major surgeries. The doctor said that despite everything he'd seen throughout his career, nothing ever topped that case. The recovery that went very wrong. Another healthcare worker shared a story about a woman who had recently undergone a hysterectomy. Doctors gave her strict instructions: no sex. Not until everything healed. Unfortunately, she didn't wait. The surgical repair failed in the most horrifying way imaginable. Part of her small intestine prolapsed through the vaginal canal. According to the patient herself, during the ambulance ride to emergency surgery, she could feel it resting against her leg, and she could feel it pulsing. The medical worker who heard the story said he'd never looked at ground beef the same way again. The 13-hour surgery, a medical student volunteered to assist during what was supposed to be a routine operation. Doctors believed the patient had a relatively small ovarian cancer. Once surgery began, they realized the situation was far worse. Cancer had spread throughout her abdomen. What should have been a 3-hour procedure turned into a 13-hour battle. Surgeons from multiple specialties were called in. The patient required massive blood replacement. Recovery was long and brutal. Against all odds, though, she survived and eventually returned home to her family. The student said it was one of the most exhausting cases he'd ever witnessed, but he never forgot how kind the patient and her family were throughout the entire ordeal. The forgotten tampon. Several medical professionals mentioned forgotten tampons. One story stood out. A woman came in complaining of discomfort. During the examination, doctors discovered a tampon that had apparently been inside her for over a month. What shocked everyone wasn't just the tampon. It was the fact that she'd continued having a completely normal sex life the entire time. The smell was so overwhelming that after she left, clinic staff spent hours airing out the room. Several employees reportedly wandered around trying not to throw up. The potato. If you think you've heard everything by now, think again. One physician recommended a medical memoir that described a woman who decided to use a potato as birth control. Yes, a potato. Apparently she inserted it and forgot about it. As you probably know, potatoes love warm, dark, moist environments. Eventually, doctors discovered that the potato had started sprouting. The woman arrived at the clinic with actual potato shoots growing out of her body. Somehow that's a real story. The cockroaches. Not every horrifying medical story involves gynecology. One former hospital volunteer described a patient who came into the emergency department complaining of chest pain. The woman was severely overweight, and everyone noticed an awful smell. While examining her, a physician lifted one of her breasts. The odor instantly became overwhelming. Underneath was a thick layer of damaged tissue. As doctors cleaned the area, they uncovered a small hole. Then things got worse. Cockroaches began crawling out. The theory was that insects had laid eggs within skin folds, and when the eggs hatched, the insects had become trapped beneath layers of tissue. Nobody in the room forgot that day. The woman who never got pregnant. A gynecology intern shared a story that would be hilarious if it weren't real. A young woman came to the clinic with 2 complaints. First, she couldn't get pregnant. Second, she had chronic digestive issues. The doctor asked a routine question: "How often do you have anal sex?" The patient answered, "Every time." Confused, the doctor asked why. The woman explained that her boyfriend had convinced her pregnancy was actually more likely through anal sex than vaginal sex. She had believed him entirely. Medical school apparently doesn't prepare you for conversations like that. The cancer nobody could ignore. One emergency room worker recalled treating an elderly woman after she suffered a fall. During the examination, doctors discovered a massive vaginal tumor. The growth was so large that it resembled a partially inflated soccer ball. It had become so extensive that it was compressing nerves and restricting blood flow to one of her legs. Doctors believed the tumor itself was likely responsible for the fall. The employee never learned what happened afterward, but given the woman's age and the severity of the cancer, the prognosis wasn't good. The surgical nightmare one gynecology nurse described the worst complication she'd ever seen. A woman came in for a hysterectomy. Early in the procedure, a surgeon accidentally injured part of her intestine. The operation was stopped so the injury could heal. Unfortunately, it never did. Instead, the damaged intestine eventually fused to the surgical wound on her abdomen. The result was essentially an opening through which waste continually leaked. What followed was 9 months of infections, wound breakdowns, additional surgeries, and constant complications. At one point, the wound had become so large that the nurse claimed she could have fit both fists inside it. After nearly a year of suffering, the patient ultimately required a permanent colostomy bag. And after everything she'd endured, the original hysterectomy was never even completed. The husband who stayed. Not every story was horrific. One medical student remembered a woman who underwent extensive surgery for vaginal cancer. The operation was life-saving, but it dramatically changed her body. Afterwards, she became convinced her husband would leave her. She reportedly begged him to find someone else. Instead, he stayed. Day after day, he sat beside her hospital bed, held her hand, comforted her, and reassured her. The student said it was one of the few moments in medicine that genuinely restored his faith in people.